It's not what I thought it would be. Have those thoughts about dental hygiene bubbled to the surface for you? Over the last couple of years, many dental hygienists have left the profession. On this episode of RDH Coast to Coast, Tina and Kim discuss the exodus of dental hygienists, potential reasons why they are leaving, and items for you to consider before leaving the career you've worked so hard to create. So friends, take a listen and learn a little more about what you can do with your education and skills before you completely leave the dental profession.
So, are you ready for this one?
I am, and I appreciate that you brought this topic up because I know that this is something that we see oftentimes in different Facebook communities or with conversations with our colleagues or past students. And so, Kim, since you brought it up, tell us what is today's topic?
Today's topic is, so this came to me actually after hearing from a couple of my previous students, three actually that have graduated not that long ago, that are already looking to get out of dental hygiene. Two of which have transitioned into front desk roles, and maybe a little bit of clinical on the side, which I hear happening more often. And then one that said to me, it's just not what I thought it would be. And it made me think, where are we going wrong in teaching or setting those expectations of what our career is? Is it the environment that they're in for their jobs, that it's not fulfilling? Or really, what could it be? So I wanted to have your take on it. Are you hearing this from any of your students? What is your take on it? Because personally, I do know that clinical hygiene day in and day out can get monotonous, and it can get lonely, and it can get boring. So how do we keep that passion alive, or what should we be telling these students to help prevent that from happening so early in their careers?
Yeah. So Kim, I've had some of my past students, transition out. Of course, I've been teaching for like 16 plus years now. So over, that period of time, there's definitely been some that have transitioned out. I have one, a couple that have gone straight into real estate. I have some of my former classmates that are now in real estate. When real estate was booming, there was a lot of people that went into real estate. But I wonder that too, especially for hygienists who maybe graduated within the last 5 years and decided, early in their career to segue out. There are times where I wonder, okay, you spent all this time, all this money, all of this energy to learn this skill set, to graduate, get your certification, get your license, and now you're not using it. And it kind of makes me scratch my head. And I have a couple of thoughts and theories behind it, where one would be that they realized that hygiene wasn't for them actually fairly early on in their education. But because they had already spent so much time and resource and energy, they're like, I got to see it through, instead of cutting their losses and leaving at that time. Right. I think that there is some sense of that probably ends up happening. And then after a couple of years of working, feeling free enough, or maybe they've paid off their student loans, to say, okay, it's time to do something different. I think there's that branch. But I also think that there's also those who really want to be hygienists and are doing, going through school, and it's hard and it's rough, and they're like, okay, it's going to be better when I get out of school and start working. And then they find themselves maybe in an office or a clinical setting that wasn't what they thought it was going to be, but didn't branch out to look and see what else there was. I think that those might be the two leading factors to go along with it, besides where people say like physical pains. Right.
Right, exactly. And that's a whole other ball game. For myself, hygiene is a second career. So I can relate to you start working and you realize your career isn't for you, because that's how it was. I was working in the financial industry. I was working 9 to 5 for corporate America. And I knew soon after I started working, this is not for me. This is not fulfilling. This is not what I wanted. So I can relate to that. I feel bad for the hygienists that come and say, this isn't what I thought it would be. And that's really when I like to explore deeper with them, is what is your working environment? Are you working in an office that is really micromanaging you and your time? Because that can be exhausting. Are you working for an office that's, kind of status quo and it's not advancing with the times? Because there's so much out there. And I think that passion to keep learning and advancing can keep that passion of your career moving forward. Would you think so?
Yeah, for sure. And I think too that and we were reading that article that Ali Morgan put out from Dental Post, where she talks about some things of like putting down your goals out of what do you want out of your career. And I think that's a really great way to think about it, because if you are someone who is like, I want to create a huge impact for multiple people. Oh, sorry about that. You want to create a huge impact for multiple people. It could be that maybe you want to go and do more public dental health and need to find and seek that out, or at least do some volunteer activities within that. If you don't have a dental public health clinic that was within your area, or can financially support you, then have your career, your position that can financially support you, and volunteer to feed that aspect of your soul, right? Don't you think? I think there's that aspect.
Yes. And to kind of piggyback off of what we talked about in another episode is networking, because networking can open up doors to other avenues that you can do with your dental hygiene degree. I find that if you ask any student or new grad, well, what do you want to do with your career? And it's, I want to be a hygienist. Like, that's what I want to do. And it's, it opens, there's so many doors that can open through networking, through, writing, being a sales rep, if you are into sales, teaching. There's so many other avenues that you can explore if you're not feeling satisfied with dental hygiene. Or sometimes it's a mix of both, right? A little bit of clinical, a little bit of sales, or a little bit of being an entrepreneur, or a little bit of writing. You can have your hand in so many different things, which can help you feel more fulfilled.
Right. And I think that's, where we go into like this, all the scope of practice for a hygienist, all the roles that a dental hygienist plays within the dental community, that we spend so much time focusing on the wet-handed dentistry aspect of it, chairside clinical dental hygiene, that I think we need to enforce and encourage the thought process that you can take this education and use your dental hygiene knowledge, use your dental hygiene experience, and not leave dental hygiene. You have to leave the dental profession, but use that knowledge in a different way. Front office, you said you had a couple of people that transitioned to front office, they're stayed within dentistry. There's a lot of value that comes from the knowledge there that they can provide to the patient in regards to education and understanding the treatment that has been diagnosed. And as we know, patients will always ask front office, what do I really need this? Tell me more about it. Like, there is that opportunity there for them to be able to use that skill set. But, that can also be used, as you said, in so many other ways, that like abandoning your career. Maybe I shouldn't say abandoning, because that's pretty harsh, but saying, okay, peace out, I'm leaving dentistry altogether. I really would, as you said, we need to do a better job of helping others identify all the different roles that we have.
Exactly. And I would love to hear more about this. Maybe we can have her on one day. But Bethany Montoya works exclusively in sleep medicine for a doctor. And that to me is fascinating. And she kind of, runs the show. And what amazing knowledge and expertise she's she's learning and doing this as a hygienist. So there's
Right.
so many different things. Hospitals now are hiring more dental hygienists and incorporating them into their staff,
Yeah,
which is
there is
huge.
actually a hospital here, like an hour away from me that has a job opening for a dental hygienist. And I'll tell you, it's very lucrative, like the benefits, the hourly
Yes.
wage, and
Yes.
you talk about a different environment that you get to do. But yes, all of those things, the sleep medicine, the myofunctional therapy, there
Yes.
is the blessings, I will say the blessings of the time that we are in right now is more states are expanding the scope of practice for hygienists, that when we have those moments of, oh, I don't know if I want to do this anymore, you can say, okay, how else can I use my license in a different way, right?
Absolutely, because there's so many ways, so many ways. And the one thing, if you do, venture out of hygiene, don't ever not renew your license.
Right.
Always keep
it, because you never
Work
know,
hard
like
for that.
life happens, life gets lifey, and
Exactly.
sometimes you're like, okay, well, I guess I'm going to go back to this part of my education and my career that I had, and you're gonna have to pick up and maybe go back to being clinical chair side, right?
Exactly.
Or there's even if you aren't clinical chair side, I will say this, there are some roles, some positions where you still have to maintain an active license. I know a lot of hygienists are in the administrative roles of like DSOs that have to still have an active license in every single state that organization is in, so that they can be there for that
Yes,
role. So,
absolutely. And that's another role that people can venture into.
well, Kim, thank you for bringing this up, and I really hope that this has been helpful for some of our listeners here. And I encourage you, and I know, Kim, you probably would feel the same, that to reach out to us if you have more
Absolutely.
questions and concerns, and you can talk to us individually, or just say, hey, RDH Coast to Coast crew. Right?
Exactly.
All right.
We're here for you.
All right, friends. So Tina and Kim saying thanks for listening, and we'll see you next time.
Yeah.
Thank you to our sponsor, Dental Post, the nation's largest dental job board. Be sure to check them out for different types of employment resources. Also, don't forget to like and subscribe to this podcast. And make sure you follow Tina and Kim on all the different social medias to learn other tips and tricks related to dentistry. Until next time, have a great day.